So let's talk about multiple sclerosis, or MS. You've probably heard of it, right? It affects millions of people, but honestly, it can be pretty confusing. In this explainer, we're going to break it all down and demystify what's really going on inside the body.
All right, to really get what MS is all about, I want you to start with this one simple question. Think about your body's nervous system, as a massive network of wiring, kind of like in a house. So what happens when that wiring starts to fray? This one idea, this is the key to understanding everything about this disease.
So, what is MS, really? Well, it's a disease where your own immune system, the very system that's supposed to protect you from germs and infections, gets things mixed up. It starts to mistakenly attack this super important part of your nerve cells called the myelin sheath. Now, the best way to think about this sheath is like the plastic insulation on an electrical wire. It's that protective coating that lets messages from your brain travel super fast and clearly all over your body. And right here, you can see exactly what that attack does. On one side, you've got a healthy nerve. See how the myelin insulation is totally intact? That means signals are just zipping along no problem. But then look at the other side, where MS has damaged that myelin. The communication just breaks down. The signals get slowed down, they get jumbled, or sometimes they just stop completely. This is that frayed wire we were talking about, and it is the direct cause of every single symptom of MS.
The name of the disease itself actually tells you a big part of the story: multiple sclerosis. When the body tries to repair that damaged myelin, it's not a perfect fix. It leaves behind little bits of scar tissue, or what doctors call lesions. The medical term for that scarring is sclerosis. So, multiple sclerosis literally just means multiple scars. It's like a map of the places where the immune system has attacked.
Okay, so we know what's happening on the inside, but how does all that internal damage actually show up on the outside? What does it feel like? Because these frayed wires can be anywhere, in the brain, down the spinal cord, the symptoms can be incredibly different from person to person. Let's dig into what MS can actually feel like.
So you'll see things like numbness or tingling, sometimes vision problems, often just in one eye, or weakness in your arms or legs. But here's the absolute most important thing to remember. No two people with MS have the exact same experience. A person's symptoms depend completely on which wires, which specific nerve fibers are being damaged at that moment.
And some symptoms can be really specific and kind of strange. A classic example is something called the Lermite sign. Imagine bending your neck forward and suddenly feeling this brief electric shock-like jolt that shoots right down your spine. It's a very distinct sensation, and it's caused directly by nerve damage in the spinal cord.
Now, for most people, the disease isn't constant. It tends to come in waves. They'll have what's called a relapse or an attack. This is when new symptoms pop up or old ones suddenly get worse, usually over a day or two. And these episodes can stick around for days or even weeks before things start to get better again. This up and down pattern is called relapsing remitting MS, and it's the most common type you'll see.
So this all begs the big question, right? Why? Why does the immune system turn on itself like this? And the honest answer is, we don't know for sure. It's a really complex puzzle, but researchers have managed to identify a bunch of different factors that seem to play a role. One of the biggest risk factors we know about is sex. Women are up to 3 times more likely to develop the most common form of MS than men are. We don't know exactly why that is, but it's a huge clue that points towards some kind of hormonal or genetic link. But here's the thing, it's never just one thing. It's almost always a combination of your genetics and your environment. So we see it show up most often between the ages of 20 and 40. It's also more common in places farther from the equator, which has led scientists to look at things like low vitamin D from less sun. Your family history definitely matters, so does your ancestry, and even being exposed to certain common viruses has been linked to it.
So just how much do genetics matter? Well, if you have a parent or a sibling with MS, your own risk of developing it is about double that of the general population. Now, it's really important to say that's still a pretty small number overall, but it clearly shows that family history is a meaningful piece of this puzzle.
Okay, so you've got this really complex mix of symptoms and a whole bunch of different risk factors. It's probably no surprise then that figuring out a diagnosis isn't exactly straightforward. Let's walk through how doctors actually put together a clear picture.
And this is so important. There is no single blood test or scan that can just say, yep, this is MS. It just doesn't exist. Instead, doctors have to be detectives. They piece together clues from a bunch of different sources to build their case.
Basically, doctors are looking for evidence in 4 key areas. First, they look at your history of symptoms, things that have come and gone. Second, they'll do a physical and neurological exam to look for signs of nerve damage they can actually measure. Third, and this one's a big one, they use an MRI scan to literally see the lesions, those scars, in the brain and spinal cord. And finally, in some cases, they might test the spinal fluid for certain proteins that are a sign of inflammation. It's only when all these pieces fit together that they can make a confident diagnosis.
Getting a diagnosis like this can feel, well, pretty overwhelming. But this is where the story takes a huge turn, to one of hope and action. So let's talk about how MS is treated and managed today.
Okay, let's just get the tough part out of the way first. As of right now, there is no cure for multiple sclerosis.
But, and this is a really, really important but, that is absolutely not the end of the story. Not even close. While we don't have a cure, we have a whole arsenal of treatments that can help people recover from attacks much faster, actually change the course of the disease over time, and manage the symptoms really effectively.
I mean, just look at this number. It tells you everything about the incredible progress we've made. A few decades ago, there were basically 0 options. Today, there are more than 20 approved medications called disease-modifying therapies. The whole point of these drugs is to prevent those relapses we talked about and to slow down how the disease progresses. It gives patients and their doctors this powerful toolkit to find an approach that works best for them.
And managing MS is about so much more than just medication. It's a total team effort. You've got steroids that can calm down a really severe attack, physical and occupational therapists who help with mobility and everyday life stuff, and just as important, you have mental health support. Staying physically active is huge, and so is staying connected with your friends, your family, your hobbies. All of it is crucial for living well with MS.
You know, this quote from the Mayo Clinic really just nails the modern approach perfectly. It says, learning to function with MS can be challenging. There are medical experts ready to work with you to help you manage it so you can still live a full life. It's not just about treating a disease anymore. It's about supporting a whole person so they can live a full, active life. It's such a powerful message of partnership and real possibility.
And that really brings us to today. Our understanding of MS has just exploded, and research is moving faster than ever. It leaves us with this one final, really hopeful question. With science advancing the way it is, what new discoveries are just around the corner that will totally reshape how we live with MS next? The answer is going to keep changing the future for everyone affected by this disease.